The Tuskegee syphilis experiment was an unethical clinical study of the natural progression of syphilis in African American males. It started in 1932, where Dr. Clark proposed an idea to the United States Public Health Service. The Tuskegee Institute, a historically black university, was also involved and provided Dr. Clark a place to conduct his research. The official name of the experiment was Tuskegee's study of untreated syphilis in the Negro male. In the 1900s, syphilis was a challenging disease. Syphilis is an STI, or a sexually transmitted infection, and is extremely contagious. There are 3 stages, 4 if you count the latent stage. In the primary stage, you experience tiny painless sores around your anal area, genitals, and mouth. Then it progresses to the secondary stage, where the symptoms are mild fevers and headaches. The latent stage is asymptomatic, but the size of your condition will worsen or not. 28% of latent stage cases move on to the last stage, but fortunately, 72% result in no other complications. The last stage of syphilis is known as neurosyphilis and is the most severe. Your organs and brains are targeted, and it can result in gait impairments and tabes dorsalis, or loss of coordination in your spinal cord. In Macon County, Alabama, approximately 40% of African Americans living there had contracted syphilis. 600 African American men were employed in this experiment, but only 399 were actually sick with the disease. The remaining 201 were known as a control group. Because of the Great Depression, hundreds of men showed up in hopes of money and a medical examination. They consented to the experiment but were not aware of its true intentions. The 600 men involved in the study were mainly poor sharecroppers who did not have the luxury of going to school or a hospital. In exchange for their participation, patients would receive free trips from the clinic and back, as well as free meals and medical examinations. If they wanted to receive burial insurance, then they had to agree to their body being autopsied after their death. The men were not told directly that they had syphilis. Rather, they were diagnosed with bad blood, a term that was commonly used in the black community at that time for many illnesses. Although they were told that they were receiving treatment, none of them were effective. They were given placebos instead, like vitamin supplements or medicine that wouldn't treat syphilis, like aspirin. In letters sent to the patients, they were deceived by the doctors and researchers of the study, who stated that this was their last chance to receive treatment and an examination from professionals. However, when the men showed up, they did not receive a normal exam or any treatment from the doctors and nurses. Instead, they were given a spinal tap procedure without any anesthesia. While the doctors did want to check if any patients suffered from neurosyphilis, some morbid researchers were also curious about the effect of spinal taps on African Americans and took this chance to analyze the data. Prior to 1947, there was no 100% effective treatment for syphilis. The first standard treatment for it was Salvarsan, which was highly toxic and those taking it could lose their limbs. Then in 1912, Neosalvarsan was developed. It was easier to administer to patients but still very toxic. However, after extensive trials and research, penicillin was declared the standard medicine for this contagious disease. It began selling in many stores where it was easily accessible. Despite the researchers being aware of this, they refused to treat the patients under their care, going so far as to hide this fact from the men. Even with the knowledge that these men could die without any treatment, the doctors did not show sympathy, some even going so far as to state that the men were only useful after their death. This was the point where the experiment became highly unethical. There were many people involved in this experiment who conducted tests and examinations, but 2 to mention are Eunice Roberts and Dr. Talia Farrell Clark. Eunice Roberts was an African-American nurse who, before the experiment, worked for the Tuskegee Institute. Due to her career, she became familiar with those living around the county and gained their trust. She acted as a liaison between these 600 men and the U.S. HPS. Dr. Clark is known as the one who is responsible for the idea of the study. His initial plan for the experiment was to follow these men's conditions for around 6 to 9 months and then provide treatment. However, the other doctors involved did not share his mindset and the experiment became twisted, prompting Dr. Clark to resign from the study after only a year. The experiment continued on for 40 years when finally, in 1972, information and details about the experiment were leaked to multiple news companies. The articles written about it caused an outroar from millions of individuals nationwide, many unable to believe what abuse these men had gone through. The U.S. HPS denied the experiment being unethical. Many began suspecting that the U.S. HPS did not allow the patients to quit the study, which further sparked anger. In 1972, the same year, the experiment was forced to end. In May of 1997, 25 years after the experiment's end, the 42nd president, President Bill Clinton, delivered an apology to the victims of the experiment. In his speech, he showed regret and apologized for the government failing to provide these men with a proper experiment. As a result of the unethical aspects of the experiment, many African Americans lost trust in both the government and the medical industry. Amongst the men that were involved, 28 died from direct syphilis and 100 died from related complications. Learning a lesson from the Tuskegee syphilis experiment, the government established many organizations to review regulations to protect those involved in studies, such as the National Bioethics Advisory Commission. The Belmont Report was also written after the experiment, detailing an ethical principles professionals should follow when conducting an experiment. While the Tuskegee syphilis experiment remains a highly controversial and unethical experiment in medical history, it has taught us many lessons. Laws have been changed, which have prevented several experiments from getting to a drastic point. As President Clinton said in his speech, what we can do now is to stand up, say sorry, and finally make a change.